name's Haley and I'm with speech therapy. How are you feeling today?
I'm doing good.
Good. So your doctor just wanted me to come in to evaluate your ability to swallow and make sure that everything is going down the right way. So you were recently diagnosed as having a brainstem stroke. So this can cause difficulties in swallowing, muscle weakness, and your overall with your swallowing muscles because of that. So sometimes food can go down the wrong tube, and this is called aspiration if it goes below into your trachea, your breathing tube. So I'm gonna have you, I'm gonna examine your face and your mouth and your muscles just to make sure everything's working properly. And I'm gonna have you drink and eat some foods and liquids just to make sure your swallow is okay. Is that all right?
Yes.
So are you having any trouble eating or drinking?
Mm-mm.
Okay. Do you have any pain or discomfort?
No.
Okay. Have you ever had problems eating or drinking before coming to the hospital?
No.
Okay. Have you ever coughed before whenever you were drinking water?
Mm-hmm.
Okay. Do you remember the last time that happened?
No, I don't. It's been a while.
Was it severe?
No.
Okay. So I'm going to just touch your face and neck to check on your muscles. Is that okay?
Mm-hmm.
Okay. I'm going to go and wash my hands really quick before I do that, and I'll be right back, okay?
Yep.
I'm also going to put on some hand sanitizer. I'm also going to sanitize the area too, just to make sure everything's clean. Okay? Good? So I want you to just look straight ahead at me. I just want to see how symmetrical your face is. Okay? Looks good. I'm going to look at your lips now. So I want you to pucker your lips up for me, please. Okay? And I want you to blow your cheeks up with air. Good. I don't see any air. Oh, can you use that for me one more time? I don't see any air coming out, so that's good. That's what I want to see. Awesome. You can stop. So now I want you to smile really nice and big for me, please. Thank you. And I want you to purse your lips. So smile, and then purse. Smile, purse. Wonderful. Okay, so now I'm going to have you push your tongue up against the sides of your cheeks. I'm just going to feel. Okay, nice strength. So now I'm going to have you go O-E, O-E, O-E.
O-E, O-E, O-E.
Good. So now I'm going to touch your face. I'm just going to make sure everything's symmetrical on both sides, okay? Like I don't feel anything. Okay. Now I want you to clear your throat for me, please. Good. And cough into your elbow. Wonderful. So now I want you to open up your mouth really wide and move your jaw from left to right. Good. So I'm going to be putting my hands in your mouth, so I'm going to go wash my hands one more time, okay? I'll be right back. Put on some more hand sanitizer. Okay, so I'm going to have you, I don't have a glove, so we're just going to use this today. I'm going to have you open up your mouth nice and wide for me, please. Okay, nice and pink. Okay, you can close your mouth. And so now I'm going to have you stick out your tongue for me, please, and move it from left to right. Good. Now up and down. Wonderful. And lick your lips. Good. Nice tongue strength. Now I want you to put your tongue up against that little ridge behind your teeth and press it up against your palate and move it back like you're pushing peanut butter back. Wonderful, thank you. And I'm going now to have you open your mouth again so I can have a look at your teeth. Good. Okay. So can you please bite down for me? Okay, and I'm gonna feel the size of your teeth. Good, nice. And now I'm gonna look at your hard palate. So that's the roof of your mouth, basically. So I want you to open your mouth up, and I'm going to put this straw in your mouth just to look at the sides of your mouth. Or your roof. Okay, looks good. Now I'm gonna feel your ridges on your top of your palate, okay? Just to make sure it's curved nicely. Good. Nice. And now I'm going to go look at your soft palate. So that's gonna be just behind your hard palate. I'm gonna put the straw back in so you can see. I'm gonna push your tongue down. Good. So now I want you to go, ah, ah, ah.
Ah, 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 ah.
Nice movement. Okay. So I want you to open your mouth again, and I'm just gonna look at your uvula and your tonsils just to make sure nothing's inflamed, okay? I'm gonna push your tongue down once more. Ready? Okay. Looking good. Nice. Okay, now I want you to please stick your tongue up on the top into your palate again. I'm just gonna look underneath it. Yep, nice attached tongue. Good. So now what I want you to do is say pa 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 for as fast as you can, okay? I'm gonna time you for 10 seconds, okay? And go. Good. Nice. Now this is to look at your rate of speech, by the way. So now I'm gonna have you do that same thing, but with ta 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 ta. Okay? Are you ready? Hold on. And go. Good. Good. Now I'm gonna have you do the same thing, but with cut. Okay? And ready. And go. Good. Now I'm gonna have you combine them to do all three, okay? Pataka, 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 okay?
Okay.
Go. Awesome. Good. So now I want you to just take a really big deep breath and breathe out. Good. Now I want you to go ahead and blow this tissue for me. This is to look at your breath support. Nice big breath. Good. So now I want you to say, ah, for as long as you can, okay? I'm gonna time you once more. Ready, set, go. Wow, that was long, like 35 seconds there. It's good, the average is like 20. All right, so now we're all done with that. So what we're gonna do next is I'm just gonna have you eat and drink some different foods and liquids just to see how your swallow is, okay? Okay, so now first I'm gonna have you have some ice chips and I'm gonna feel your throat just to make sure everything's going and moving up and down correctly. So I'm gonna have you take a spoonful of ice and then chew it a little bit and then swallow. Good. Did you feel like that went down okay?
Mm-hmm.
Good. So now I'm gonna have you have some water on this spoon. Here, you can do it. You were able-bodied. Okay. Swallow. Okay. Do you feel like that went down okay?
Yep.
So now I'm gonna have you drink the water out of the cup for me, please. Good. That feel okay?
Yep.
And I'm gonna have you do it with a straw. Good?
Yep.
Here. All right. Now I'm gonna have you have some nectar thick liquid, okay? So first I'm gonna do it on this, have you do it on the spoon. And I'm gonna just do the same thing with the water. I'm gonna feel it when you, after you swallow, while you're swallowing. Okay, does that feel okay?
Yep.
Now can you take a drink for me? That feel okay?
Mm-hmm.
Going down okay? And, yep, you're already on it. Straw. That okay?
Mm-hmm.
Good. Awesome. Now we're gonna do this honey thick liquid. So I'm gonna have you put it on a spoon. Feel okay?
Mm-hmm.
Now a drink, please. Good. Does that feel okay?
Yep.
And straw. Okay?
Mm-hmm.
Now I'm going to have you try this pureed food. We don't have applesauce, so we're just going to use yogurt instead. So if you can please take a spoonful of that. And I feel like I just did other stuff. Okay, did that feel like
Yep.
it went down good? Okay. So now I'm going to have you do a mechanically soft food. So that's a banana. So you can eat that. Okay. Do I feel like it went down okay? And chewing was all right?
Yep.
Okay. So I'm just going to check to make sure there's any residue. Good. So I'm going to now have you do a regular solid. So that's I'm going to use a graham cracker. Can you have a bite of that for me, please? Do I feel like it went down? Okay. I'm going to look and make sure there's nothing left over. Okay. Good. All right, so based on what I just observed, your swallow is excellent. It looks great. I don't see any difficulties. You didn't report any difficulties to me. You don't have any, right? And you didn't cough or anything, so that tells me that everything appears to be going down correctly, down your esophagus into your stomach, and not into your breathing tube or your trachea. Nothing appeared to be entering your windpipe. So I'm gonna go and ask you, do you have any questions for me right now? Okay. So I'm gonna write up a report and I'm gonna tell your doctor that I didn't see anything abnormal, everything looks all right, and you are safe to just eat regular solid foods and regular beverages at any thickness and for your current diet. So
Thank you.
you're welcome.